Welcome to my channel, Body Talk.
Welcome back, guys. In this video, we know about hypertension, high blood pressure. Your blood is pushing too hard against the walls of your arteries when you have hypertension or high blood pressure. Due to the fact that this ailment typically has no symptoms, many people are unaware that they have it. It can result in a heart attack, stroke, dementia, kidney disease, and other problems if left untreated. Treatment and early diagnosis can save lives. What is hypertension and how manage and treat it if you want to know? So please watch till the end of this video. The force of blood pressing against the walls of your arteries is too great. When you have hypertension, also known as high blood pressure, your heart must work harder to circulate blood throughout your body. As a result, your heart and arteries are harmed by hypertension over time. Serious consequences, such as a heart attack or stroke, may result from it. High blood pressure is frequently referred to as a silent killer because it typically has no symptoms. Medical professionals use millimeters of mercury mmHg to measure blood pressure BP. There are two numbers in your reading. The highest figure is the systolic blood pressure. When your heart contracts, it puts pressure on the walls of your arteries. The lowest figure is the diastolic blood pressure. When your heart relaxes, it's the pressure in between beats. The definition of high blood pressure varies slightly depending on where you reside. Healthcare professionals in the United States define it as a systolic blood pressure reading of 130 mmHg or more, or a diastolic blood pressure reading of at least 80 mmHg. A top value of 140 or higher, or a bottom number of 90 or higher, is considered hypertension in Europe. Hypertension types depending on the underlying cause. There are two primary forms of high blood pressure. Primary hypertension. This indicates that your high blood pressure is mostly caused by your age, genetics, and family history. Secondary hypertension. This indicates that your blood pressure is elevated due to a known reason, such as a medical condition, medicine, or addictive substance. High blood pressure symptoms. Typically, hypertension has no symptoms. You could have it for years without experiencing any symptoms. According to estimates from the World Health Organization, 46% of adults with hypertension are unaware that they have the condition. You may have the following symptoms. If your blood pressure is too high, modifications to the way your mind works, pain in the chest, slightly deadens, or swelling, palpitations in the heart, urinating less frequently than normal. We refer to this as a hypertensive emergency. If you have any of the aforementioned symptoms and your blood pressure is 180/120 or above, dial 911 or your local emergency services number immediately. What is the cause of hypertension? For the majority of patients, medical professionals are unable to identify a single cause of hypertension. Rather, a variety of things may combine to raise your blood pressure. Among them are being older than 55, having a biological family history of the illness, using tobacco products or smoking, being obese, or overweight. Sometimes medical professionals are able to identify a specific reason of your high blood pressure, such as an underlying illness, drug, or substance. Here are a few instances. Conditions such as primary aldosteronism, thyroid illness, renal artery stenosis, and obstructive sleep apnea. Drugs that treat autoimmune diseases, inflammation, ADHD, and mental health issues. Consuming sodium-rich mucilate, exercising enough. This condition's complications under hypertension overstresses your heart and destroys your arteries. Eventually, it could result in AFib, your heart's erratic beat that impairs its ability to pump blood. Chronic renal illness, kidney function issues that may worsen with time. Dementia and cognitive impairment, modifications to your personality, memories, and way of thinking. Heart artery narrowing or blockage is known as coronary artery disease. A heart attack is when your heart suddenly stops receiving blood. Heart failure, a chronic illness that impairs your heart's capacity to pump blood. Retinopathy, caused by hypertension, eye damage that could result in blindness. Your arms or legs may have narrowed or clogged arteries due to peripheral artery disease. Having trouble getting an erection is known as erectile dysfunction. How medical professionals identify this illness during your yearly checkups and other appointments. Medical professionals take your blood pressure. This enables them to determine if it is excessively high or typical. If your levels are high at to different appointments with at least 2 readings obtained each time, they will diagnose you with hypertension. What stages of hypertension are there? The 2 primary phases of hypertension are: if your top number is in the 130s or your bottom number is in the 80s, you are in stage 1. Stage 2 indicates that either your bottom number is 90 or higher, or your top number is 140 or higher. How doctors diagnose this condition? Your blood pressure is taken by medical professionals during your annual checkups and other appointments. This allows them to assess if it is typical or abnormally high. They will diagnose you with hypertension. If your levels are elevated at two separate appointments, with at least 2 readings taken each time. What are the phases of hypertension? There are 2 main stages of hypertension. You are in stage 1 if your bottom number is in the 80s, or your top number is in the 130s. Either your top number is 140 or higher, or your bottom number is 90 or higher. So thanks for watching, see you soon.